Thank you, Mr. Chairman, and good morning, colleagues. Today we welcome two leaders from the Food and Drug Administration to our subcommittee, and this is the very first time that they are testifying before us. So welcome to you, Mr. Jones, and welcome, Dr. King. Today we're going to discuss the work of the Center for Tobacco Products and the Human Foods Program. The FDA oversees the safety of more than $3.6 trillion worth of food and drug products produced in the United States and abroad. 21 cents out of every dollar spent by American consumers goes toward a product that's regulated by the FDA. The Human Foods Program represents the often neglected, at least in my view, the F in FDA, and oversees more than 78% of our nation's food supply. FDA regulations cover about 35,000 product farms, 300,000 food establishments, and 10,500 vending machine operators. That one I was not aware of. The Center for Tobacco Products oversees more than 100,000 tobacco products in the United States, including cigarettes, cigars, smokeless tobacco products, e-cigarettes, and vapor products. Central to the work is the leading cause of preventable death in the United States each year, with 1 in 5 deaths due to tobacco use. 1 in 6 Americans suffer foodborne illnesses each year, contributing to more than 128,000 hospitalizations and 3,000 deaths annually. Americans depend on a strong FDA to protect their families. Last year, parents in Maryland discovered their child had 6 times the minimum level of lead in his blood after he consumed applesauce pouches containing contaminated cinnamon. Now they worry that their son will be developmentally delayed due to preventable lead poisoning. In 2022, infant formula containing bacteria killed 2 babies and caused infections in many others, despite FDA receiving a whistleblower complaint a year before. The complaint was, quote, inadvertently archived, unquote, according to the IG of HHS. A high school student from Oklahoma had to relearn how to talk and move after she was placed in a medically induced coma after one of her lungs collapsed from vaping. So this work, the work of the 2 witnesses before us, touches the lives of every single American. And it's done with less than a third of FDA's entire budget. The centers have long been overlooked and, in my view, under-resourced. Today, we're going to examine several proposals to support your immense mission. The Tobacco User Fee Modernization Act, introduced by Representative Jennifer McClellan, reauthorizes the assessment and collection of user fees for tobacco products, critical to fund faster, thorough FDA reviews of tobacco products, which we all agree is necessary. The Federal and State Food Safety Information Sharing Act, introduced by Representative Deborah Ross, authorizes HHS to share timely information on foodborne illnesses and recalls with state, local, and tribal authorities. The Infants Act, produced by our ranking member, Mr. Pallone, and Representatives Cardenas and Sykes, require baby food products to be tested for toxic heavy metals to better protect the youngest amongst us. Several other bills we'll discuss take action on decisions the FDA has long delayed regarding dairy products, domestically produced oranges, and honey. I hope the FDA will make it easier for people to be informed consumers and not more difficult. And I hope the FDA will act rather than wait for Congress to essentially force its hand to make these changes. So I look forward to this hearing with our distinguished witnesses today. on how Congress can help the agency better manage its massive responsibilities. Thank you, Mr. Chairman, and I yield back.